Greeting everyone. Assalamualaikum warahmatullahi wabarakatuh. Good evening, good afternoon, good morning to all of the participants from around the world. Welcome to the second series of SinarKU and SONJO Solidarity Journey. This is a collaborative program of the Department of Economics, Universitas Gadjah Mada, University of Southampton, and SONJO, or Sambatan Jogja. Before we start, let me introduce myself. My name is Sakar. I'm a lecturer and a researcher at the Department of Economics, Universitas Gadjah Mada. In this webinar, we will have 6 speakers, but before that, we have to go through some kind of like housekeeping rules, and we also have the Dean coming today. Thank you, Pak Eko. We would like to ask you for some opening remarks, but to keep everything running smoothly, we're just gonna have to, go through quickly some rules, some housekeeping rules that the participants must adhere to. So first of all, this is a recorded webinar, and all of the recording will be available on YouTube. If you haven't watched the first one, it's also available on YouTube. The slides will be available on the mentioned link. We hope that all participants are muted except for the panelists. Some presentation will be delivered in Bahasa, but don't worry, we will have interpreters that will help with the translations. The discussions Q&A session will be held after the presentation is done. So we'll be having 6 speakers present their materials, and then we'll go through the Q&A session. To ask questions, you have to write it in the Q&A box, so it's not in the chat box. Please take note. You can also use the raise hand feature, raise hand button in the in your Zoom window. If I call your name, then I will. You have to unmute your speaker, and then you can ask the questions directly. If you do not. If you want to use Bahasa to ask your questions, that's fine too. I can interpret the question for you. And last, we will have to ask you to rename your Zoom with this particular format. So we need your name _ your institution, just for us to make it easier for us to address you and your institution when you're asking a question. All right, so before we start, I would like to welcome Bapak Eko Suwardi. Pak Eko is the Dean of Faculty of Economics and Business, Universitas Gadjah Mada. Thank you so much, Bapak, for attending this event. We would like Pak Eko, for his time, to give an opening remarks. Pak, please, Bapak, maybe around several minutes, don't be too long. Connection is yours, Bapak. Thank you.
Thank you, Bu Sekar. Yeah. Thank you very much. Can you hear me?
Yeah, clearly,
Yes.
Bapak.
Okay, thank you very much. Okay, very good evening and very good morning from all audience around the world. Dear respected and honored speakers from Indonesia and also from UK, Professor Sabu, Professor Paurav, Professor Michelle, Dr. Rimawan, Ibu Dr. Ani Widayani, and Dr. Gumilang, and of course all organizing committee and also all participants in this very important webinar. I'm delighted to welcome you in this kind of very important webinar, because as we know that the pandemic still happens around the world, including in Indonesia and also in the rest of the world. We are still not sure when the pandemic is going to end. And this webinar with the topic Social Capital, Induce, Adaptation, and Innovation, I think is very important aspect to empower our community in combating the spread of the pandemic. And that is why, on behalf of the academia of the Faculty of Economic and Business, we are quite happy with SONJO under Pak Rimawan, and also of course the Southampton University, and also Pemerintah Daerah Kabupaten Bantul for our collaboration. I think with the collaboration and raising the issues of the social capital with the local wisdom, we do hope that our problem can be solved by the society itself, of course, based on the hand in hand among us in the society, and also among us around the countries, and also among us around the globe. Once again, thank you very much, our respected speaker from Southampton, from Pemda Bantul, Ibu Ani, and also of course Pak Rimawan, and also of course Ibu Sekar for inviting me to be part of this webinar. Once again, I congratulate to all participants and good luck for our webinars this evening in Indonesia, and maybe this morning in this afternoon in UK, and this morning in United States maybe. Thank you very much. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Pak Eko. It's been more than a year that COVID-19 ravaged our lives. Millions of deaths, millions of people affected, and for so many people, life will never be the same again. But I think despite all of the hardship, I just want to personally say that human ingenuity prevails, right? We adapt, we innovate, we persevere. The theme of the webinar today is very important in a sense that how should we promote adaptation, innovation during this pandemic through social capital. So today we will have not one, not two, not three, but 6 speakers from around the world. The first one is Pak Rimawan. He's the head of Department of Economics, Fakultas Economics and Business, Universitas Gadjah Mada. The second one, we will have Pak Gumilang Aryo Sahadewo. He's the Vice Director of Master in Development Economics of FEB UGM. And then the third one, we will have Ibu Daerah Ani Widayani M.I.P. Ibu is the head of Sumbermulyo village, head of Adaptasi Bantul. Salam kenal Ibu, greetings. The next one we'll have Professor Sabu Padmadas. Good afternoon, Professor. He is a professor of demography and global health, the Associate Dean International Social Sciences from University of Southampton. And then we will have Dr. Michael Head. He's the Senior Fellow in Global Health in the Faculty of Medicine, University of Southampton. And also we have Professor Paurav Shukla, Professor of Marketing, Head Digital and Data-Driven Marketing from the Southampton Business School. So we will have 6 speakers tonight or this afternoon if you're in the UK. Due to our limitations, speakers, I would like to apologize in advance that we will have only 10 minutes for each of you and to present your materials. And then we're going to pull all of the questions at the end of the session. So just to have everyone present their material first. And I will let you know when you have around 2 minutes left during your presentation. And if we have listened to all of the presentation, and then we're just going to move to the Q&A session. I hope you're okay with that. I know that some of you have like, I don't know, a lot of slides, and by now you have to like sort out all of the slides that you have to hide from the audience. I'm really sorry for that, but yeah. Anyways, so we will start with the first speaker. I would like to invite Pak Rimawan. You will have 10 minutes, Pak Rimawan, to present your materials, and the time and connection is yours. Thank you.
Thank you, Mbak Sekar. This is my presentation, ladies and gentlemen. Good afternoon and good evening. I just want to introduce about the SONJO, and especially we'll discuss about the role of SONJO in health. And later on, my colleague Mas Gumilang would like to express it in economics mostly. So basically, we start from here. This is the way we perceive the COVID, and if we see the COVID is basically is like when the nature changed, or the state of the world changed drastically, and obviously we have to adapt to the new state of the world, and don't expect to return back to the pre-COVID era, because if we still thinking about that we move back to the pre-COVID era, that's basically we will not do any adaptation, we will not do any innovation. So this is the flyers that was laying around during March to last year, and when I see that, at first I'm just thinking, is it true? And I doubt about that, because one is that basically indeed that we are in the same store. I agree with that, but we are not in the sea, and we are linked by internet. And in the old days, we have the what is called sambatan. This is the way like a social capital that's been rooted in Java, and of course also in across culture in Indonesia. We do have that kind of social capital actually. Now the question is that how can we use internet in order to reuse again, or trying to reinvent again the sambatan. So this is the way we perceive as well, whether we want to see this as a disaster or as a war. So I'm thinking about more in a war rather than the disaster. And what are the dominant strategies? There's three things: expect the unexpected in terms of the impact, and then thinking into it innovatively in terms of the solution. And the most important thing is how to do the resource mobilization. And if we see the resource mobilization, then the question is that let me count the resources that we have. And in Indonesia, of course, we cannot rely on 100% to the government, because the government budget obviously will not be sufficient. So the question is that how can we use how we can mobilize the resources from the household and also the businesses. So that's why we use the way the Sambatan Jogja or SONJO. Yeah. So this is the Sambatan Jogja, and we have, what is the focus? So basically, we have what I call the mission-driven organization. So we focus on the vulnerable people and people at risk during the pandemic, and we're trying to help them. And the value is based on the integrity, transparency, empathy, and also the synergy. And why do we use the WhatsApp? Because everybody uses WhatsApp. Most people in Indonesia are using WhatsApp, so it's easier for us to contact people and discuss with people through WhatsApp rather than using other media. And on the average, Indonesian spend 3.5 hours basically in social media. And then the question is that will it be possible that everybody spend about half an hour, to do social work, something like this. So this is the idea basically behind SONJO. Now this is the 19 WhatsApp group. So 2 weeks ago, Pak Sabu attended the webinar. It was 18 WhatsApp group, now become 19 WhatsApp group. It's growing quite fast. It's because of the needs that we have in the field, basically now. And this is the development, and we do have the compliance committee. So we start with the one WhatsApp group, and then it's become it's growing quite fast to be 19. And we also have a compliance committee. So the compliance committee actually to ensure that there is no moral hazard or anything in a SONJO. And we use the website, database, apps, and social media. We utilize all of them basically in our movement. Now the question is that is it does SONJO is related to charity? No, we are not charity, but we are a movement. So I'm sort of like a self-help group, basically. And we don't receive any funding until now. So how do we do it? So basically, the way we do it, just like sharing responsibility. So we start with the notion that everybody has resources. Now, the question is that how can everybody contribute their resources in terms of the time, in terms of the willingness to sacrifice and willingness to help others in the SONJO. And we don't use any funding whatsoever up until now. So in a way, we create what I call the public goods, basically. And why is it that this one is public goods? Because look, when during the pandemic, it's actually many people they have lots of burden, and the transaction cost is very high. Now, how to facilitate the transaction cost is how to reduce that is by creating the public goods for everybody. Okay. Now, this is the learning curve, and the learning curve is quite fast. Actually, we start from something simple, and then we follow the process, and then we scaling up. And now this is the one that's very important. Actually, is the knowledge management. And the knowledge management is based on three programs that we have. The first is the Angkringan. The Angkringan is like a webinar, a weekly webinar, and we reach until episode 56. So every single week we do that. And also the Mikunani. Mikunani is actually sharing skills among members. So if you have any skills and you want to share with everybody, please feel free to do so. We put it in a Zoom and then upload it in YouTube, and then we upload again in our website, and everybody can use it. Everybody can access that. And also we have a SONJO Kebijakan, which is a policy. Now this is the only WhatsApp group which use Chatham House rule. And we talk to the government, we talk to the central government until the district government and also provincial government. And so this is the way we do in terms of the knowledge management. So in terms of the coverage, that we work on the three sectors, which is health, economic, and education. And these are the program in health. So I just want to concentrate in health. So we have 11 program, and I want to introduce not everything, but it just start from number 5. I think that's more important, because that's. So this is start from number 5, which is how to manage the corpse, the infectious corpse, basically, because this is quite daunting actually, and that's create conflict in society if you don't do properly. That's why we create this kind of program to disseminate to people. And also we have a database, and this database is basically about the referral system. We help the government in creating the database for the referral system across the hospital at that time. And why is it that this happened? Because during December until February, we have such a patient at that time. Now this is you can see the database is look like this, and also we have now this one is the SONJO Solidarity, is basically the way to finance the some of the activities, and mostly we trying to support the shelter, the existence of shelter. Do we receive the funding? No, it's actually we have many donors who would like to join, and then people pay to the donor, and then the donor pay pay directly to the shelter. So we don't receive any funding whatsoever. And then we have also the database for the shelter in Yogyakarta. At the moment, we have 60 shelters across Yogyakarta. 2 districts joined with this program, which is Sleman and also Bantul. Yeah, and in the shelter, and then a village shelter, sub-village shelter, and also pesantren. Now, pesantren is the Islamic boarding school. Okay. Now, of course, the implementation is quite varied from one region to the next. So what we do is basically we adapt to the system that take place in the region. Now, we also have this. This is the pilot project for managing the infectious. What is that? The infectious waste. Yeah, and we work together with the village, this kind. And then we also have what I call SONJO Pasar Desa. So SONJO Pasar Desa is actually, this is the way to help the shelter with the operating costs, especially the food costs. So the way we do is just basically we help them with the package of food, and then this is for every single patient. They receive about £9 basically for 10 days. and the women association will cook for them. So this is the way we do. And the Pasar Desa is actually the marketplace that has been created by the Panggung Show. And last is about the Sonjo Saras. This is the last program that we have. It just emerged last Friday, and this one is the way we're trying to help the pesantren, and also the village on how to develop the shelter, because we need to ensure that the quality of the shelter is up to the standard. So if I just close with this one, so basically if we talk about Sonjo, what is Sonjo? So Sonjo is like we provide a Doraemon pouch, so you can pull anything from there. And then we're trying to be trying to provide the public goods for in terms of health, economy, and education in relation to the tackling COVID-19. Okay, thank you, Mbak Sekar. This is it for me. Thank you.
Wow, Pat, that was like 10 minutes. You make my life as a moderator so much easier. Thank you, Pat Rimawan. And I think it's really incredible how we didn't even think that we would come to this, right, Pat Rimawan? You know, having this pandemic and everyone was trying to be like, living a new kind of life. And, for a lot of people that new kind of life was not something that's pleasant. In us, as a human, as a part of society, it's our compassion, like us being compassionate to other people. That's what creates the movement. And I adore everyone, the volunteer, everyone's involved in Sonjo. I think we need a lot more people doing something like this. Need to be replicated in some other part of countries as well, probably abroad too. All right, thank you, Pak Rimawan. The second one, the speaker, I would like to invite Mas Gumilang. Mas Gumilang will be talking about one of Sonjo's program, if I'm not mistaken.
That's correct,
all right.
Sekar.
Okay, awesome. Then I'll give you 10 minutes. Please make my life easier as well, like Rimawan. I'll keep the time. If you have 2 minutes left, I'll let you know. Thank you.
Thank you so much. Again, thank you so much, Dr. Sekar, for the opportunity. First of all, I'd like to extend our welcome to colleagues from the University of Southampton, as well as from other universities around the world. This is an exciting opportunity for us to share some of the initiatives that we've done. I guess in the past year, it was really quite shocking that the pandemic came to life in Indonesia. And I think, having volunteers, as well as having a lot of, having Sonjo, it's really nice, to get things going again for the economy, as well as the micro and small enterprises, which will be the focus of the talk today. And so I'd like to present community-based initiatives to mitigate the COVID-19 effect among micro and small enterprises. So as a background, there are about 64 million micro, small, and medium enterprises in Indonesia. And then only about 13%, or about 8 million of micro, small, and medium enterprises that are, that have gone digital. So there's a lot of adaptations and innovation that the rest of the micro and small enterprises have to go through during the pandemic. That's something that they need to do because statistics show that about 84% experience significant drop in revenue. About 8 out of 10 micro, small, and medium enterprises experience lower demand from customers and clients. They also face difficulties in obtaining a lot of the logistics and then inputs for their businesses. And then 6 out of 10 micro, small, and medium enterprises experience financial difficulty during the pandemic. So the economy was basically buzzing. The economy is growing. People were spending. Households and businesses were investing in the economy. And then the COVID-19 pandemic basically brought a significant disruption to the economy. So there were a lot of adjustments that has to be made. There were lockdowns, that basically limit the mobility of individuals and limit the mobility of businesses, and that created significant disruptions. And so basically in the early stages of the pandemic, lockdowns are basically inevitable. It's basically a policy that would reduce the rate of transmission, and as well as protect the health infrastructure in the country. However, there is a trade-off. As we know, the limited mobility has a significant cost to the general economy, not only the big businesses, but also the micro and small enterprises, as well as the informal sector. So what are the strategies to reach out to customers given limited mobility and keep the economy rolling while keeping the rate of transmission low? Well, one of the strategies that we can think of is the adoption of technology and going digital. So it's a solution. However, among those 64 million micro, small, and medium enterprises, a lot of them are actually first digital goers. A lot of them have never been exposed to technology, and many of them haven't been exposed to social media and then online digital marketing. So there were a lot of challenges: low digital literacy, limited access to training, particularly business training, limited budget and knowledge to adopt technology, lack of knowledge on online marketing strategies, low financial literacy, and lack of product innovation. Of course, there are other more challenges out there, but basically it's very much difficult for these micro, small, and medium enterprises to suddenly change the way that they do businesses, given the constraints that they have, not only infrastructure constraints, but also behavioral constraints. And so, okay, we need to go digital, and then we need to adopt technology. But what are the steps to go digital? So it's quite difficult for the government to say, okay, we're gonna have 10 million micro, small, medium enterprises to go digital without realizing that most of the micro, small enterprises are in different stages of development. So some of them even don't have smartphones. Some of them do not have access to internet. However, there are probably a small share of micro, small, medium enterprises that have gone digital, they have experience, they probably consist of younger generation, so it's quite easy for them to go digital. And so I think acknowledging that MSCs are in different stages of development and are and have different constraints to go digital is a particular start before we devise any interventions or any programs. So it's a good opportunity for policymakers as well as academics, given that there's a lot of scholars out there that did rigorous impact evaluation studies to evaluate different programs and different interventions to improve the livelihood and the productivity of micro and small enterprises. And so we're not able to basically test and evaluate during the pandemic. And so I think our approach was to learn from the literature, and then given what we learned from the literature, how could we best implement interventions or sets of interventions given the constraints and the cultural aspects of people in Indonesia. So we know that marketing, sales, accounting, and financial training interventions improve MSE profitability, as well as training, mentoring of MSE. There were also programs such as subsidized consulting services by business mentors that improve micro and small enterprises, as well as social networks program. So in these social network program, they have regular meetings to discuss financing, management, supplier, clients, and recruitment to improve sales and profits. And so basically, this is the way that we approach the program. So we have series of online marketing tutorials. We have a progressive web app to showcase the MSME, and then we have a community-based marketing, and then we have a peer learning through social networks. So I'll start with the first one, which is the online marketing tutorial. It's a series of messages in WhatsApp groups of SME that includes YouTube link to learn how to create a business logo, how to take product pictures, how to create a product poster, as well as how to create how to market online via webinar. And then we also created a progressive web app to showcase the MSME. This is called the Etalase Pasar Sonjo. So basically, this is a showcase of businesses. And the idea is not to have transactions within the application, but instead we need to showcase the products and then the businesses, and then let the individuals who are interested to do the transactions via the WhatsApp. So we do this not only to onboard MSME to a digital platform, but also for them to learn about even as simple as registering an email and then communicating with customers, and then making sure that basic level of business services are maintained during the interactions with the customers. And to support some of the earlier initiatives, we also collaborated with our colleagues at the political science department to market these products and these goods via social media such as Instagram, Twitter, as well as WhatsApp groups in Sonjo. And then there is a very, I think, interesting series of webinars. And in these webinars, basically, we try to motivate peer learning through social networks. So in this webinar, for example, we discuss about innovative packaging and freezing, which is quite effective during the pandemic. However, packaging technology such as vacuum packing is not easily adopted by MSME. It costs a lot for a trial, and the machine itself is going to cost them some funds to adopt. So there are trial and errors, and so we basically learn from peers in the social network who have successfully adopted the strategy of vacuum packing, and so this would reduce the adoption costs significantly. Now, given that a lot of the MSME have now adopted the vacuum packing, they're now able not only to sell their goods domestically, but they were also able to sell their products in other regions via customer logistics. And so this is something that we're very grateful of, given that there are a lot of individuals in the learning networks who shared their knowledge and their experience. So in Sonjo, we motivate a graduation approach. Basically, this is a learning and upgrading community. And so we're hopeful that individuals as well as enterprises who are familiar with digital platforms and they have a business service level of agreement that they can maintain, they're now able to join established online platforms. It takes a lot of work, and then it takes a lot of stages to go to that point. But I guess the experiences that they gain in the smaller community will allow them to actually flourish in the wider market. Also, learning and upgrading through the community allow them to improve the product line, and then they're able to create a series of products or product lines. For example, this is something that we did back in the month of Ramadan, particularly prior to the Fitr holiday. There were a lot of MSME who created festive seasons catalog, and Sonjo also has an initiative to expand the market, not only the domestic, but also the international export market. And so Pak Rimawan and then Sonjo team have a Sonjo expert community to motivate people and then to connect people to the wider international network. So as closing remarks, again, to improve digitalization among the MSE, the government must first identify the MSE's stages of development, and then the government tailor interventions or programs that suits MSE stage of development. So it's quite difficult for the MSE if they have to attend a training that is, say, 2 or 3 stages beyond their current capabilities and their current abilities. So having a tailor-made program to specific groups of MSE with the same level of learning is going to be, quite impactful. And there needs to be a qualitative evaluation on the impact of SONJO's initiative on the productivity of MSE. So learning about successes, failures, and best practices adopted by MSE during the COVID-19 pandemic is an important lessons learned for the wider audience. Thank you so much for the opportunity. I look forward to having discussions with everyone tonight. Mbak Sekar, over to you.
Thank you. Thank you, Mas Gumi. So I'll let you talk 2 minutes, 3 minutes past your time because it was so interesting. So I didn't really want to stop you. But anyways, I feel like what you have mentioned, the things that you have done in Sonjo, it's kind of like forcing the MSE to MSME, right? MSME to kind of thinking of just beyond the business as usual, what they did before the pandemic, because now they have to, survive, not just survive. No one should survive. Everyone should thrive. That's what I'm. But anyways, not just surviving, but also thriving, and having, a kind of community. They can learn together. They can kind of know what they need, and before they might not even think about it. As long as I can make a good living, that's it, right? But the hardship itself forced them to do something more than just surviving. But yeah, it's a really great initiative. Thank you for that, Mas Gumilang. Thank you for sharing this with us. Definitely. All right, so the next one, I would like to invite Ibu Ani Widayani. Ibu, she is the head of Sumbermulyo village in Bantul region, Yogyakarta. Ibu Ani will be talking about social capital and how that matter in countermeasure against the COVID. Ibu, we haven't met each other before, but salam Ibu. I also admire what you have done. Bu Ani will have 10 minutes. We will have Pak Sabu, Michael, and Paurav after this, but 10 minutes is yours, Bu Ani. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. Selamat malam, salam sejahtera bagi kita semua dan salam sehat untuk kita semua. Perkenalkan, saya Ani Widayani, Lurah Desa atau Kepala Desa Sumbermulyo, Kapanewon Bambang-Lipuro, Kabupaten Bantul, Daerah Istimewa Yogyakarta dan Indonesia. Pada paparan kali ini yang akan kami sampaikan adalah gotong royong merupakan modal sosial dalam pengelolaan shelter bertingkat di Kelurahan Sumbermulyo, Kapanewon, Bambang-Lipuro. Namun sebelumnya akan saya sampaikan profil Desa Sumbermulyo. Bahwa profil Desa Sumbermulyo dengan luas wilayah 819,93 hektar dengan jumlah penduduk 15.913 jiwa, terdiri dari 5.811 kepala rumah tangga. Sumbermulyo merupakan daerah pedesaan dan terdiri dari 16 padukuhan 115 RT. Strategi utama dalam menanggulangi pandemi COVID-19 yang pertama adalah tindakan preventif dan promotif, Kemudian yang kedua adalah tindakan kuratif dan rehabilitatif. Untuk tindakan pencegahan yang pertama yang kami lakukan adalah satu, pembentukan relawan COVID-19, relawan desa aman COVID, baik tingkat desa atau tingkat kelurahan maupun tingkat paduan. Yang kedua adalah menyusun regulasi desa yang berkaitan dengan kesehatan dan keselamatan. Yang ketiga, pengembangan sistem komunikasi antar warga, baik dengan WA group, SMS, dan lain sebagainya. Yang keempat, media sosialisasi terkait COVID-19, baik dengan poster, leaflet, video, pesan suara, dan lain sebagainya. Kemudian yang terakhir adalah pengembangan tim untuk penegakan protokol kesehatan. Tindakan pencegahan yang kedua, yang pertama adalah memberikan bantuan langsung tunai dana desa. Yang kedua adalah dengan padat karya tunai desa dan padat karya tunai atau cash forward. Karena banyak warga masyarakat kami yang kehilangan mata pencaharian karena COVID-19. Banyak warga yang kena PHK. Dan yang terakhir adalah kolaborasi dengan unit pelayanan kesehatan, Puskesmas, Babinsa, Babin Kamtipmas, dan lain-lain. Tindakan kuratif yang kami lakukan, kuratif dan rehabilitatif, antara lain satu adalah dengan memaksimalkan fungsi shelter yang ada, baik shelter desa maupun shelter paduan. Shelter desa berfungsi untuk isolasi warga masyarakat yang positif COVID dengan tanpa gejala atau gejala ringan. Kemudian untuk yang shelter dusun atau paduan, ini dipergunakan atau diperuntukkan bagi warga yang melakukan kontak erat dengan pasien positif COVID menunggu hasil swab. Nah, adapun kegiatan berikutnya adalah kami beserta warga masyarakat memberikan logistik baik untuk pasien yang ada di shelter maupun untuk warga yang melakukan isolasi mandiri. Karena memang ada sebagian yang melakukan isolasi mandiri karena memang rumahnya luas dan juga ketat dalam melaksanakan protokol kesehatan. Tetapi mayoritas warga kami wajib di shelter desa. Kemudian berikutnya adalah melakukan pemakaman dengan protokol kesehatan. Semua dilakukan oleh relawan desa atau FEB tingkat desa. Kegiatan berikutnya adalah penyemprotan disinfektan di rumah-rumah yang terkena kasus ataupun infeksi COVID-19. Kemudian mempererat atau memperkuat jejaring channeling kolaborasi dengan pihak-pihak yang lain. Ini adalah kegiatan pemakaman yang dilakukan oleh FPRB kami, 100% semua dilakukan oleh FPRB atau relawan desa. Shelter berjenjang yang ada di desa Sumbermulyo atau Kelurahan Sumbermulyo. Di Kelurahan Sumbermulyo ada 3 shelter berjenjang. Yang pertama adalah shelter tingkat distrik. Ini merawat atau tersedia 50 tempat tidur. Bisa menampung 50 pasien. Kemudian yang kedua adalah shelter desa. Shelter desa ini juga bisa menampung 50 pasien. Dan ini dikelola oleh relawan desa, pemerintah desa, dan masyarakat desa murni. Kemudian yang ketiga, ada 16 shelter paduan. Kami ada 16 shelter paduan, semua paduan mempunyai shelter, di mana dikelola semuanya oleh warga masyarakat dan relawan paduan lawan COVID. Pasien yang kami rawat di shelter tingkat desa selama 5 bulan, mulai dari bulan Januari sampai bulan Mei, ada 102. bulan Januari ada 10, bulan Februari 15, bulan Maret 19, April 20, dan bulan Mei ini terjadi lonjakan yang sangat signifikan, hampir naik 2 kali lipat, 38 pasien. Kemudian warga kami yang terpapar COVID ada 271. Kemudian persennya, Mbak, 271, yang sembuh ada 246, artinya 90,77% sembuh. Kemudian ada 4 yang meninggal, 1,48% meninggal, dan ada 21 yang masih diisolasi, 7,75% diisolasi. Keberadaan shelter di Desa Sumbermulyo, bahwa shelter ini bukan membangun bangunan baru, tetapi shelter ini adalah satu, memanfaatkan bangunan umum atau rumah yang jaraknya cukup jauh dari kantor desa maupun dari kawasan padat penduduk. Kemudian yang kedua, memiliki fasilitas dasar seperti tempat tidur, air, kamar mandi, ruang yang cukup untuk melakukan olahraga, serta bisa diakses oleh kendaraan roda 4. Kemudian kenapa Sumbermulyo dengan gigihnya mendirikan shelter? Yang pertama alasannya adalah warga kami, warga Sumbermulyo yang terpapar COVID ini fluktuatif dan cenderung meningkat. Apalagi kita tidak tahu kapan pandemi ini akan berakhir. Yang kedua, desa kami harus selalu siap untuk menyiapkan skenario terburuk jika terjadi lonjakan kenaikan pasien COVID-19. Yang ketiga, lebih aman berada di shelter daripada isolasi mandiri. Karena ketika di shelter, 24 jam kami bisa memantau. Ketika terjadi kegawat daruratan, bisa langsung dirujuk ke RSLKC atau rumah sakit pemerintah, sehingga rumah sakit tidak terjadi penumpukan. Yang terakhir, fasilitas shelter ditanggung dari berbagai komponen, baik dari pemerintah desa, puskesmas, masyarakat, lembaga-lembaga yang peduli, sehingga desa kami tidak terbebani dengan pendirian shelter tersebut. Kegiatan berikutnya adalah vaksinasi. Bahwa vaksinasi untuk lansia yang kami lakukan, program ini menjadi prioritas untuk mencegah kelebihan beban rumah sakit akibat lonjakan kasus di kalangan lansia. Kemudian kami bekerja sama dengan Dinas Kesehatan Kabupaten Bantul dan juga dengan elemen-elemen masyarakat. Ini merupakan cara kami untuk meningkatkan partisipasi lansia dalam vaksinasi. Kemudian triple health dalam membiayai tindakan penanggulangan COVID-19. Yang pertama, bahwa penanganan wabah COVID-19 dapat berjalan dengan baik karena terbangunnya kolaborasi dan sinergitas antara pemerintah desa, masyarakat desa, relawan desa, puskesmas yang ini bagi kami merupakan internal kami, dengan pemerintah daerah dan juga lembaga-lembaga yang peduli terhadap COVID-19, salah satunya adalah SONJO. SONJO ini tidak hanya memberikan bantuan berupa logistik dan APD, tetapi juga memberikan bantuan teknis terkait dengan pengelolaan dan memastikan kualitas pelayanan shelter yang aman bagi pengelola, aman bagi pasien, dan aman bagi masyarakat sekitar. Saat ini, SONJO telah mendampingi 44 shelter di Kabupaten Bantul untuk mendapatkan sarana dan prasarana dari OJK maupun IJK, juga dari lembaga-lembaga yang lain. SONJO telah membantu desa-desa di Kabupaten Bantul membangun jejaring dengan lembaga-lembaga yang peduli pada COVID-19, termasuk membangun jejaring dengan para ahli di bidang pencegahan dan penanganan wabah COVID-19. Ini adalah ketika Bapak Menteri Kesehatan melakukan kunjungan kerja di shelter desa Sumbermulyo, juga di shelter-shelter Paduan. Kemudian di tahun 2020, Bapak Menteri Desa juga melakukan kunjungan kerja di rumah karantina desa Sumbermulyo, karena ketika itu wabah pertama kami langsung mendirikan rumah karantina yang sekarang rumah karantina kita rubah fungsinya menjadi shelter desa dan shelter Paduan. Dan alhamdulillah saat ini desa Sumbermulyo merupakan percontohan penanganan shelter tingkat nasional dalam rangka untuk memutus mata rantai COVID-19. Demikian yang dilakukan oleh relawan dan pemerintah desa Sumbermulyo dalam rangka untuk secepat mungkin memutus mata rantai COVID-19. Terima kasih.
Matur nuwun sangat Bu Ani untuk paparannya. Izinkan saya berbicara bahasa Indonesia dengan Bu Ani ya. Mumpung ada interpreternya juga ini Bu Ani. Matur nuwun sangat. Memang kalau kita lihat tanpa triple helix tadi sepertinya ini nggak akan mungkin bisa terjadi nggak Ibu Ge. Bahwa kemudian dari pihak desa, kemudian juga network dari Sonjo, kemudian bisa mengumpulkan berbagai macam lembaga untuk kemudian bisa membantu upaya supaya ya maunya kan memang tidak membebani rumah sakit gitu ya, tidak membebani tenaga kesehatan dan sebagainya. Jadi memang kalau saya lihat di sini memang butuh sebuah effort yang itu tidak hanya dari satu pihak saja, tapi juga didukung oleh banyak pihak. Matur nuwun sangat Ibu Ani sekali lagi. And then, ladies and gentlemen, we will have a speakers. I would like to invite Professor Sabu, Dr. Michael, and Professor Paurav from University of Southampton. I heard that you will present something about quick reflections of what's been happening. I know that probably this is something we've been talking about. Sonjo, we've been discussing a lot about this kind of thing. Probably you will have like 10 minutes each to kind of like having some thoughts, probably reflections or any kind of things that you want to present today. So yeah, Professor Sabu, please, the time is yours. Thank you.
Thank you very much. I think you've been really doing a marvelous role. I mean, in terms of really organizing this this wonderful event. But good morning, good afternoon, good evening, colleagues and friends from wherever you're joining. I know that there are lots of colleagues joining from different parts of the world. Some of whom I know. Selamat sore, terima kasih. We are absolutely delighted to join this esteemed panel and also be part of this very important initiative. I think it is also about the roadmap for collaboration. I think that's exactly what is needed in today's world. And as we talk about the pandemic, I think before that, I think I'd like to really start by congratulating Pak Rimawan, Pradiptyo, and team, including Pak Gumilang, and also at UGM and Ibu Ani for joining forces to tackle an infection threat that has put the whole world in standstill and in a complete reverse gear, right? So this has never happened before. And what we have seen so far in most parts of the world, although this has really affected the middle class populations, as well as the whatever upper income groups across the world, the poor seems to be most affected, disproportionately affected. And we heard today about shelters, provision of shelters. I think these are really some of the core initiatives that we should be really looking at in terms of really preparing for the next future pandemics and so on. And also we are dealing with large populations. So Indonesia is the fourth most populous country on the planet with this huge density, but also it's surrounded by more than thousands of islands, and I think that geography is very important. So I was just reflecting also on the kind of the Ebola outbreak in the 1976. I think when it started, sort of, at that time, the world was not really that globalized, or, we didn't have enough of that mobility in that time. But, when it struck back in the early 2000s, it was, I think, around 2014, I think, it was actually out of control. It was the fatality rate was extremely high. And some of the countries, like particularly Guinea, Sierra Leone, and also Liberia, I think these were the 3 countries in Africa. Probably they were landlocked in some case. I think that's hence, the virus didn't really move out. But if it had gone out just like the COVID pandemic, I think we would have been, probably the world would have been wiped out by now. The humanity would have been wiped out by now. But the point is that I think in those circumstances, when an outbreak like Ebola happened, there was an understanding, because we knew what the virus was, what the structure, RNA structure of the virus was, and so on. Although the vaccine was not really developed as well. So, so there was actually a struggle to contain Ebola, and it struck, and we had repeated outbreaks since 2014. And even last year, we had outbreaks in Congo and a few other parts of the world. But I think COVID happened in a very thick, populated, most populated country on the planet, China. That's the origin, and we know that that Wuhan is probably the place where where there's a lot of considerable amount of mobility and so on. So I think so. Hence, today we are really seeing that this has become a global pandemic, because it has exceeded small geographies to very big geographies, almost the entire kind of a planet. And the game is not over. The virus will hide and recede into its what is known as the reservoir host, waiting for the next opportunity or wave. So, but can we afford? But we cannot afford to be on this situation forever, because I think that's not going to really sustain that'll create lots of other challenges for us. So, Rimawan, I think you've correctly highlighted by saying that we cannot rely on the government, and absolutely you're right. I think we had this discussion previously as well as with the WHO, and the point is that the governments can only do a little. I mean, they cannot actually provide, but of course they need to have some kind of steer and directions. But at the end, it boils down to communities, small communities, and simple innovations like SONJO, focused on community, can make a difference. And this is actually the key message from today. And indeed, this is the time to test new ideas, scale up and sustain these initiatives. And more importantly, I think why we have gathered today is that we all have a moral responsibility, a corporate responsibility, a social responsibility, a political responsibility or obligation to share best practices for the larger community and benefits. I think that is really fundamental. So what can we learn from this experience, this SONJO experience? I mean, as you've correctly said, it is just a WhatsApp-driven initiative, but the way that this has really mobilized the entire community, the community mobilization has been the of this program. And I would say that, it's a technology-enabled community mobilization. So today, internet has penetrated widely in remote areas of the world. I think, within the next 1 or 2 years, we will see a digital revolution in the world. And so, therefore, I think, initiatives like SONJO has tremendous scope actually to manage and control this pandemic. And also the way that I think the WhatsApp group, I think that you've mentioned that you have now 19 groups that's active, and with that 19 groups connecting to different supply chains across different sectors. And that is very, 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 very key. Like, for instance, and you can't really implement this without the support of the local authority, like as we heard from Widayani, that commitment is very important. So political commitment or that social commitment, community mobilization, and then the whole coordination of supply chains is fundamental. And this has actually happened, and this similar models have worked out in other parts of the world. For example, in Kerala, I know that the place where I was born, I think it has always been a world laboratory for, for public health interventions. And the state really managed to succeed, I mean, in the initial phase. And then because of the community cohesion and the community model. But once that responsibility, that social responsibility moves away from, because I think people take it for granted. So when people have vaccination, they think that, well, look, the world is resolved. I think we are confident. And so, for instance, just 2 days ago, I was in London, and I was surprised to see that, well, people were not wearing masks at the moment. Probably there is an assumption. Well, I mean, you would expect that, well, there is the viruses have their own different stages of or phases of influence, and we don't know when this fourth wave or the fifth wave is going to happen. So it's all about preparation. It's about disaster management and preparedness. And once we know that a model has worked, then the next time it's quite easy to really bring that on board and then probably make it work. Because I think it's at the end, there's a saying that, well, you don't look for umbrella when it is raining. So you be ready with the umbrella, before rain. So that's exactly the message that comes out from today. I don't want to really keep my conversation too long, but I would like to really say that the models like these, I think these need to be shared and tested. I mean, across the world, that's very important. As well as we need to also think of systematic evaluation and monitoring of such wonderful initiatives. Like, for instance, I've seen that from Ibu Ani's presentation, like, in terms of the data that you've generated, in terms of real data. And again, that goes back to a moral obligation of the government, of the systems, to share data so that you would be able to really understand, well, the effectiveness of these interventions. Because sometimes what happens is that people just spend millions and millions of rupees or whatever, or dollars or pounds on programs without reflection. And I think that's something that is very needed. And fortunately, I think in the UK, the data systems have been really incredible. I mean, in terms of the way that we have coordinated, and particularly in the place where I am talking from, Southampton has been really an outlier in terms of the COVID management, which my colleague, Dr. Michael Head, who is an expert in the field, I think he would be really reflecting on some of these as well. So I think I'll stop there, but also just to really say that, well, what a phenomenal effort, and this needs to be really documented systematically. And at Southampton, we would be really happy to collaborate with you, also linking with other institutions across the world. I think I'll stop there. Thank you. Terima kasih.
Thank you so much. I think that was a really important to look at social responsibility in that. Again, in the time that we haven't even thought about that it could happen something like this, and it needs like extraordinary measure, right? We haven't thought of like community-based movement before because we thought we didn't need that. But then, when all other things are shut down, and you don't realize that information is the most important resources, and people keep them for themselves. But then, when you join to this kind of movement, and then you're like, okay, now you know a lot of things from just talking to other people, and I think that's very important to learn.
Community is indeed the solution. I think there is. I think what Pak Rimawan said today, I echo that, because I think no matter whatever the investment is, no matter what the political leadership is, that it all boils down to community and also managing this infection in small, or containing these in very small clusters. And then, you have a threshold of, let's say that, well, for instance, below 2% or 5%, whatever, to make sure that, well, the infection is under control. So that's very important. And I think also in terms of the vaccinations, I think there is quite a lot of work that needs to be done. But I'm sure that there will be questions from our panel and from the audience that we can tackle. Thank you.
I will ask that question if no one asks that question. But yeah, so so the next one, I will invite Dr. Michael Head. Again, I think you would also have some sort of like quick reflections, just Professor Sabu did. Yeah, please. 10 minutes is yours. Thank you. Or more if you want. Of course, that's fine too. Thank you.
Thank you very much indeed for the introductions, and it is absolutely wonderful to be able to speak with you all here today. It's my first connections with Indonesian colleagues, so hopefully there may be some really useful avenues for collaboration coming out of this. I will present some slides in a minute, which I put together quite quickly just before the start of the seminar. And I think that some of the research that I'm doing, which is mostly focused West Africa, a bit in South America as well, but mostly West Africa, I think the focus on innovation, appropriate innovation in a resource-poor setting, as well as the focus is on community health. I think there could be some really interesting synergies between what we have going on here at Southampton with our Ghanaian and Togo partners in Africa, with some of the work that's been presented here today. So let me just share my screen. Let's share and then. So hopefully you can now see my slides.
Great.
So there's my email address and Twitter account. If you use such things, by all means do get in touch, and I'm happy to share these slides. So please do ask if they will be useful. I'm based in the Clinical Informatics Research Unit. Our focus is on innovation in healthcare and research. I won't go into detail as to what these various groups are, but there's a lot of research governance, help with health policy, both in the high income setting, for example, across the UK Health Service, but also in resource poor areas as well, for example, including in Ghana and Brazil and Ethiopia. We've also got strong links with the Asian eHealth Information Network that my boss, Professor James Batchelor, is strongly connected with. So as I said, most of my research is focused on Ghana and Togo. I'm going to present a bit on some of the COVID-19 research and also a brief focus on my other area of interest, which is neglected tropical diseases. This is where we're talking in the world. So you can see in West Africa, just north of the equator, in Ghana and Togo. I'm going to focus on Ghana. The capital is Accra, down on the south coast. And we also have research going on in the rural area of Nkwanta. And this butterfly on the left, that's the Ghanaian flag. Now, we've been doing a lot of work looking at vaccine hesitancy and trying to support the vaccine rollout in Ghana. So as part of that, we've done some surveys, particularly with the general population. And you can see here some of the knowledge and attitudes around COVID-19. Most people have got the hang of it, that it's a severe illness transmitted between people. But there is also a fair amount of misinformation out there, often passed on via WhatsApp groups. I think perhaps like Indonesia, in Ghana, WhatsApp is probably the main communication method, the main electronic communication method. They don't use Twitter so much. They're quite big on Facebook, but I think the information around, for example, vaccines or COVID-19, good and bad, is transmitted a lot via WhatsApp. And this is our first report. We're going to update that in the next month or so around vaccine hesitancy in Ghana. It's open access on Figshare. And we've done 2 surveys so far. A third one is ongoing. In August last year, 62% of the population were willing to be vaccinated. When the vaccines arrived in Ghana, that went up to 82%. But we are concerned around particularly around the global north and our reporting around adverse events, particularly with the Oxford AstraZeneca vaccine, and whether that will undermine the vaccine rollout in the global south. We're currently having a bit of a look at that. These are some of the main predictors of vaccine hesitancy, gender being the main one, actually. Females far more likely to be hesitant than males. But also you can see this bottom point here, that people who received COVID-19 information predominantly from family members or friends were more likely to be hesitant. And again, that's predominantly transmitted via WhatsApp groups. And this is our ongoing survey. So from March, we had 82% willing to be vaccinated. So far, the survey's not complete, but there's a slight decrease in willingness to be vaccinated and therefore an increase in hesitancy. And we are, in the data we're collecting, exploring the reasons why. Can't present that to you yet, but in the next 2 or 3 weeks, we should have that information. So we can present that to the Ghana Health Service and to say that this is the kind of key sources of information and this is where the messages are being presented. One other area of innovation we're working on is, can we use mobile phone, self-reporting from mobile phones to detect outbreaks early? And this is using a platform that can use any mobile phones, not just a smartphone, any phone. Can it be used to detect outbreaks early? And it's also the sort of platform, this is a platform that's Ghanaian led and owned, by the way. It could also potentially be used to flag up other healthcare needs. So if there are other outbreaks of infectious diseases, if there is a famine or earthquake or flood, then again, a service like this potentially could alert national or district authorities that there is a community at great need. This is what the system looks like. Essentially, you dial a number free of charge, and then you get presented with a series of questions like this. So, are you coughing? Press 1 for yes or 2 for no. And then you answer just 4 or 5 questions, and that information gets passed on to the district health service. This is what the back end of the Opine World platform looks like. This is example data rather than real data. You can see the map. It tells you roughly where the person is located, and also some summary presentations of the questions that they've answered. So you as a district health officer can then look at that and decide if you need to go into any particular district or sub-district to investigate these reports. We're also going to look at long COVID in Ghana as well. We've got a data set of about 3,000 confirmed COVID-19 patients who attended a treatment centre. We're going to look at whether they have long COVID and also investigate levels of, well, stigma, mental health and well-being as well. That will start in the next 2 or 3 months, hopefully next month. On neglected tropical diseases, so scabies and onchocerciasis are 2 of the bugs that I research. These are some pictures of scabies wounds. These ones on picture A and picture D are from the UK, actually. There's quite a few scabies outbreaks in care homes for the elderly. So they are patients in some of the care homes that we went into. It doesn't kill many people, but it is a very, very nasty infection. So you can imagine that these wounds being particularly itchy and unpleasant for the individual to have. We published a study in, well, we did a study in Ghana that was led by the Ghanaians and supported by Southampton. That's been published in 2020. And this is just one slide from it. We mapped where people were coming from and going to in terms of where they reported their skin infection. And essentially we found there was a lot of bypassing of their nearest health facility that generally went further away. And it's entirely possible that they would often go to Nkwanta, the main town, on market day. So it might be that they combined a visit to the market with reporting their skin infection, because many of the cases came from a long way away but ended up in Nkwanta District Hospital or one of the health centres in Nkwanta. So from that, we can start to get a picture together of healthcare seeking behaviour, sort of when and why and where people go to get their skin infections looked at. Bear in mind, it is a stigmatised condition. It might be that you want to go somewhere that's a bit easier to be anonymous and where people don't know you quite so well. So this is some good data to try and explore some of those thoughts a bit further. And that took place in Nkwanta in this part of Ghana. And onchocerciasis is transmitted by the black fly, and it's an unpleasant skin neglected tropical disease. So it causes this, and it's called leopard skin style presentation. And it also causes eye infections as well. Again, it doesn't really kill many people, but it is a very seriously unpleasant bug to get and to be infected by, and it does impact your quality of life. So I assume in Indonesia, you probably have mass drug administrations. I'm sure you do. They do in Ghana. The next mass drug administration, we're going to equip community volunteers with electronic devices of some kind. They currently use paper forms, and it's time consuming to fill out, and it makes real-time analysis impossible. It's usually 6 to 12 months later by the time those paper records are scrutinised. So we're going to test the feasibility of using the local community members who carry out the MDAs in their own area. We're going to give them devices, electronic tablets, and essentially see whether they can record data and whether that can be accessed and used in a timely manner, in particular during that ongoing MDA. Ghanaian colleagues are quite confident this is the way forward. Ghana does like digital health quite a lot. It is putting a lot of focus and resource in that area. So, but we're also thinking, can it be applied to public health emergencies? So we are also going to use this approach to gain data around vaccine hesitancy. So we're going to give devices to volunteers in rural and remote communities to gain insight into what those communities think about COVID-19 and about the COVID-19 vaccine. So that will give us valuable information from hard to reach areas as to whether they would be likely to take up the vaccine or not. So that is all I'm going to say. Hopefully I'm within my 10 minutes. But yeah, thank you very much indeed. Again, my email address is there if you wish for the slides. But I'm more than happy to continue these discussions. I think these are very, very exciting times. And I look forward to learning a lot from you all going forward. But for that, I shall hand back to our chair, and thank you very much for listening.
Thank you. Thank you so much. I think we learned a lot as well from the cases that you, or the studies that you did in Ghana, especially the long COVID. I think I don't think we have talked a lot about that in Indonesia. Whereas, you know, if you look at a lot of cases in the UK, in the US, people that got like mild symptoms from COVID, but they have like, you know, it's almost like the post. It's the PTSD, you know, the post, kind of like more like affecting their mental health, their well-being, their productivity. That's happening for quite a long time after they got COVID. So it's not necessarily just that when you're like getting like a really bad symptoms and you got like hospitalized for a lot of weeks, but you know, young people, productive age, they got long COVID as well, and something that's a lot of maybe that's just having to do with the way that we're still thinking of when you get COVID, then that's it. When you're recovered from it, you're not going to get, you know, you're not going to feel any other effect. Again, that's something that's really interesting. Also, the hesitancy. We, at least me, but talking to a lot of people, there's a lot of hesitancy as well in terms of like the vaccines. I don't know whether that is why our vaccination rate is not as high as other countries. But I think here it's more into the rural area rather than the urban one. I think in Ghanaian case, that's the other way around, right? It's the urban people that doesn't want to get vaccine. Am I right?
Yeah, although our survey is going to be a little bit biased because it was done via the internet, so it would require an internet connection to do the survey. So therefore, most of our population was urbanized. Hence why we're quite keen to do that second survey I referred to, where we're going to give community volunteers devices to go and collect further data from rural areas. That will hopefully kind of balance out our data a bit nicely so we can get a bit more insight into what rural populations are thinking. But yeah, I think hesitancy is going to be a problem. I think certainly anecdotal feedback from Ghana is that a lot of healthcare workers did not take up their offer of a first dose. So if the healthcare workers don't, particularly in rural areas, the community often looks to their local healthcare worker, who is highly respected in the community. So if the local healthcare worker doesn't get vaccinated, then the community probably won't either. So there are problems with information and misinformation, and we do need excellent health promotion across the world, but across, you know, urban to rural areas within places like Ghana. So it is going to be a key issue going forward, and it will be with us for, I think, alas, a long time to come yet.
Yeah, and I think across the social media platform as well, right? As you said, you know, WhatsApp is not only circulating good things, also circulating bad things. And and if you're not really well informed of what a vaccine is, it's gonna just increase the rate of hesitancy in the community. Thank you so much, Dr. Head, for the presentation, for the materials. Thank you so much. For the next one, I will invite Professor Paurav. Are you there?
Yes, I am. Thank you. Yes. I hope you can see me.
Yes, I can hear you very, very clear, and I can see you as well. So you'll have 10 minutes to present any kind of materials, or if you want to do some reflection,
sure.
Please do so. You have the time is yours. Thank you.
Fantastic. Thank you very much, colleagues. I'm going to present a little reflection only on the SONJO program based on what I'm hearing and what I've heard about it. And on the basis of that, I'm thinking about all my work is around the whole idea of value. Why do we value what we value? And so from that value lens, how come Sonjo is providing value to all the participants that are engaging in it and beyond, and why it is successful as it is, and then a reflection on how can we make it even more successful for the future? How can we make it stick? Because many a times, one of the problems, in a way, what Sabu was just mentioning, if you remember, that he went to London and what he found was people were not wearing masks anymore. So community solutions to get them to actually stick for a long period of time is extremely difficult. And so how do we create value to make them stick is what I want to talk about. And I want to provide some reflection. Now, Pak Rimawan, you have done such amazing work. So in some ways, when I'm looking at it, I'm thinking, my Lord, without any funds, you have done this. Wow to that. And that's why some of these reflections may come as, half-baked, but we would love to have this chat with you. And potentially, both ways, in a way, we will learn from the initiative and we will be able to provide some sort of help in that regard. And we would be more than happy to do that. So with that in mind, I would just also suggest people, colleagues who are joining this call, many of you would want to connect with me. And there are a number of ways you can connect with me. And particularly in my last visit to Indonesia, I realized how popular Instagram is. And hence, I've also added the Instagram here in the social connections list. I also just am reflecting that my last international visit was actually to Yogyakarta. And in Jogja, we had such amazing time with the UGM colleagues. And I'm looking forward to hopefully visit Jogja again and provide further collaborative opportunities at both ends for Southampton as well as UGM. So without further ado, let me try and talk to you about why communities become successful. And there are three major reasons. In a way, this is our work on value, and one of my co-authors is actually with us right now, Joyce Singh, who has joined this call. And there are three particular fundamental values that drive success. The first being the functional value. So when a person sees that what kind of physical attributes this community has, what is this community trying to do functionally? Is it trying to make lives better? Is it trying to make things better? What are the physical attributes of this community? And so choosing of WhatsApp, I think, was a very powerful message to people that this is one, free, and secondly, it is available to everyone. So it is not, it is not unequal. It's an equality-based community. It is a democratized community. And I think that functional attribute was a very important aspect of Sonjo. The second aspect, and I was so fascinated by hearing about one of the talk about, Pak Gumi in regards to the whole idea about entrepreneurship. The experience that was provided and that experiential value that was created. What experiences does this community offer in terms of, community spirit itself? And that is so important. When these experiential values are there, people would tend to engage more. And when Pak Rimawan presented the idea of, those, and my pronunciation would be very bad, so I'm not going to do that. But in terms of, the incentives to people to engage, and those incentives created experiences. When people could see that something was happening to somebody, and this could happen to them also, that experiential trigger would lead people to engage more with it. So it is not just because by nature we are not altruistic. We human beings have this selfish gene inside of us. And we would first want to see what's in it for me. When we start seeing these experiences, they allow us to create value. So that was another very, very fundamental mechanism that led to this community engagement. And the third thing is this symbolism. When my friends are doing it, I will do it too. This is very important to us. And I think in Indonesia, we have seen it already. I come from India. I've seen this type of initiatives in India, and I've seen that when others who I feel are important, and especially when university academics who are seen in such high regard are engaging with this, I should also engage with it, because it would be a noble cause. And so that is another powerful other-directed symbolism that has driven this whole initiative. And I think then after, when all of this is happening, what does this community mean to me comes the question. That is self-directed symbolism. And people will continue to engage. So one of my first reflection for this to become a very successful future engagement is that we continue this functional, experiential, and other symbolic aspects. But at the same time, we start making people feel this self-directed symbolism. Inside of them, they feel, in a way, Pak Rimawan, you are doing it. Why these UGM colleagues are doing it? Because you have this innate need to serve the community. Now, that does not come naturally to most people. And so the point here is how do we make it natural for people? And at that point in time, by itself, it will become a social innovation that would stick. As in terms, it will not float away and go away into the history, becomes a case study and that's about it. And so this is my first particular point, that how do we create that wherein it becomes a part of the community in such a way that people start saying it, this is my duty to do this. And so it's very important. A second part I'm talking about is this work Jai and I again are doing right now with Benedetta Casafeli at Birkbeck. And wherein we are looking at, we have seen plethora of CSR, what we call corporate social responsibility or community social responsibility, however you want to put it, CSR initiatives globally. We are right now analyzing them, and we think we have found a very interesting typology around this. So I want to present this typology and make one more point in regards to this reflection on Sonjo. The first thing I'm thinking about right now, because a point very early in the first presentation Pak Rimawan mentioned was the philanthropic nature of the activity. This was a resource hungry activity, but it was done for free. Because again, a free platform like WhatsApp was available, so people were able to do it, but it was very much philanthropic. Currently, the activity looks pretty, while it is strategic in your minds, but to a participant, it would look very ad hoc. And its resource alignment is very low because different activities are being done with a greater community engagement, but there needs to be a very clear direction, a mission that people can buy into. And I think that would drive this whole activity from a philanthropic CSR to a social innovation CSR. And I think that is where it will become sticky. That is where it will become a permanent solution within Jogja region, and then potentially across Indonesia, and who knows, globally. So I think this initiative has a tremendous value. I'm looking at it from, when Michael was presenting the idea on West Africa, and I'm thinking about Southern Africa, and when M-Pesa system emerged from South Africa, and then it became such a solution, and how many new solutions have emerged on the top of M-Pesa system, is that one innovation has led to a complete set of innovations, and those are sticky in nature. So in some sense, community ownership, but at the same time, it has to be seen from a social innovation rather than a philanthropy perspective. And I think from that perspective, when Professor Padmadas mentioned that, at Southampton, we would like to continue working with us, and we would like to find ways in which we can try and find implementable resources, potentially grant funding, and then build more onto it, would provide us tremendous scope for making this sticky. So with that in mind, I'm just going to give a few pointers right now for, as I see from my perspective, for Sonjo. And I think it's a very, very successful initiative. And my God, I can't say how wowed I am right now with regard to the work that you have done. But think about these value systems, this value orientation. What kind of value is really driving this community engagement? And how can we continuously pin on that? And then let's try not to withdraw the community engagement spend, else then the survival depends on it. But neither it has to, this community engagement spend has to be made. And from a final reflection perspective, it is worth thinking more strategically now with this initiative and increase its share of voice. What, Ibu earlier presented, wherein, community engagement, how can we build that within the community to feel that it is their own duty to do it? It is their own part of identity to do it. And obviously we'll have to think about those value generation activities. So I'll stop here. I think I've talked quite a bit, but I hope I have provided some reflection in terms of how Sonjo looks from an outsider perspective and how it can be made sticky and social forever. Thank you all very much.
Thank you so much, Professor Shukla. I think it is really important point to make that it should be not something that's ad hoc. When COVID is done, then this initiative will be done. This has to be something, as you said before, kind of like social innovation that could be implemented for something else as well, not just for COVID. Probably we're gonna have, God forbid, something bad happened in the past. We do have the template to, kind of like gear up the community to have this kind of initiative again and again. So, I mean, as I said before, this is something, it's truly remarkable. Pak Rimawan to start everything. He started everything, and now it's become what it is right now. But had we don't have Pak Rimawan, this kind of thing, I don't know. I'm not. Well, probably there are Pak Rimawan, a lot of Pak Rimawan out there, but I mean, this is a hypothetical situation. But I don't feel like this would be there if Pak Rimawan was not, the one who started all of this. So, but so that's why we need to create some sort of a system, not kind of system, but make it more into something that's not ad hoc anymore, but something that's embedded within us, right? This is what you said about social innovation, and I think it's something that we can replicate in the future, but without the upgrade into, social innovation, rather than just philanthropic movement initiative, but something that, so we can kind of like have that all over the world, because we don't need to create Pak Rimawan. It's just something that comes out of ourselves, right?
That's it.
And that's yeah, it's and I think as an academics, and we have a great responsibility to make that happen. So I hope that there will be a lot more discussion, collaboration between Southampton and Sonjo team, UGM, to, as I said before,
we are looking forward for sure. I can tell you.
To continue the collaboration. All right. So thank you so much, Professor Shukla. We have 6 speakers presented the materials. I think we will move on to the question and Q&A session. We only have like 25 minutes, so I'll give 2. Maybe we'll have 2 questions, and then we have another session of 2 questions if we have still have more time. I see someone raising her hand. I think hopefully I address you correctly. Renta Christiana, do you have any questions for any of our speakers? Yes, go ahead.
Okay, thank you for the time, Mbak Sekar. I think my question just for the last presenter, Professor Suka. I know that we are very optimistic on this, but at the same time, I might ask if there are certain component that makes the community will be sustainable? Is the value, and then how the people use it as a functional and also experiential enough, or do we need other things like maybe continue leadership, or I don't know, maybe you can give me some answer on that to making sure that this will run for a long way. Thank you. Thank you, Mbak Sekar.
Yeah, terima kasih, Renta, for your fantastic question. First thing I would say is, yes, leadership is important, but with community engagement, what happens is when it becomes too leader-centric, the problem is, for example, right now, Pak Rimawan could lead the whole initiative and do all these things. But when there are, 1,000 people involved in the process, right? One person cannot manage it all. So we cannot, in a way, we would love to replicate him 1,000 times. That would be most amazing, but that is impossible. So at that point in time, this decentralized leadership can only happen when people feel self-directed symbolism towards the community, which is wherein you and I feel that it is my duty to contribute in whatever way I can. And when that happens, when that is inculcated into community, suddenly you will see that the community will just thrive. The community, even if there are negative or positive interactions, negative or positive experiences, community will continue to thrive because people have taken leadership. People have taken ownership of the community. So when the communities are owned by one or two or a group of people, they tend to become concentration of power. They don't tend to grow. But when communities are driven by the message of that this is community, in a way, I would give you an example of a very interesting community. It's a global community called XDA forums. A lot of Indonesians are actually top moderators in that technology forum. And this is a community of what we call phone enthusiasts, smartphone enthusiasts. So they don't talk just about, my smartphone has this system or that system. They actually develop further systems. And they have no money. Nobody gives them any money for developing something new. They are doing it because they feel they are contributing to the community. They are feeling that by doing that, they are getting some sort of recognition. It is their feeling of contribution is driving that community. Now there are more than, I think, 10 million people who are part of that community. Now that's global community, and it's just thriving on its own. Nobody has any control over it. But the idea is so powerful. And so that idea matters in a way. Now we have this SONJO idea. What we need to do is have this community create its own leadership, and things will happen. And that's why those values matter, that people must be able to see that this is clearly physically advantageous for the community and oneself. It is clear, the experiences are very clear for everyone to see. And others also who are important people, according to that community member, are also part of that community. And things will happen. Things will happen. So I hope that gives you some answer on, we could talk about our values all day, but I don't want to hog the time here. So thank you very much. Terima kasih.
I think I agree that symbolism is really important, especially in our culture. And academic is very, very highly regarded professor in our community, in our culture. So having academics to kind of like be a driver of this movement matters a lot. And I'm not, probably if you look at, politicians or government, people might think that, oh, okay, that's their job anyway. But now having, people outside the government, outside the politics, to do something that is very, very selfless. It is something that's very, kind of like valuable lesson to be having in the future. And thank you so much for, again, it's a something that we probably haven't thought of it before, that this is kind of like an ad hoc movement, but I think Sonjo and Pak Rimawan should really think about the future and how to create something that's, you know, sustainable in the long run. So it still be continuing even though the COVID stops, right? Something's really important. Is there any question from the Q&A box? Oh, I have 2 other questions. I think, is it okay if we address one question at a time? So maybe, you know, continue with the questions, and then the next question, I think it's going to be better. A question to Professor Padmadas: what can be the best way of making people understand the danger of COVID-19? There are so many people not complying with the health protocols right now. I think this is something connected to as well with the kind of like the informations, probably the vaccine hesitancy, if you want to go into there as well. How to make people understand that the COVID is really dangerous, and you know, there are a lot of COVID denials out there as well. How should we really cope with that problem?
Yeah, thank you, Niken. I think that's a very, very valid question. And some of this, which we have also heard from Professor Paurav Shukla. So I think what I would say is that, well, it's also about, you know, experiences and you know, so WhatsApp as a system could also be used to really share proper communications. Now, one of the challenges that I think I did ask this question before, I think, to Pak Rimawan about that coordination of messages, the right messages. And well, of course, people are really reflecting on the experiences. So in the case of India, very recently, what happened was that people started really seeing, you know, the adverse impact, people dying all of a sudden, and that too, looking at the age group. So usually what happens is that it's very difficult to control young people. But here, I mean, India is one example where we saw a very, you know, a systematic shift in the infection rate among young people. So, so we are talking about something like 1 in 5 of those people who died were really below 30 years. And that really gives alarm. So it's actually sending alarms, but we also don't want to really, you know, create panic. So the objective should not be really focused on creating panic or fear, but actually providing the right message. So that's why we need to be thinking not just from a public health perspective, like we need expertise, like, you know, like about from digital marketing, for instance, the way that communications can be channeled and in the right format, and for which you would need a coordinated effort. Because if you receive multiple messages, a small group of people saying that, look, we don't need to worry about it, COVID, because, you know, nothing happened to me, and the other group is saying that we need to worry about it, it's not going to work. So there has to be some kind of coordinated efforts and documentation. At the end, I think, like, you know, a very important point that we heard today from Paurav is that, well, it's the ownership, right? At the end of the day, I think the community will have to really take ownership and responsibility, saying that, look, this is, you know, we are part of this. In fact, the community should be made part of the solution. And once that is really, so that's why, and that's a challenge, huge challenge, because I think world bodies have really struggled to understand this, even including the WHO was struggling for a while to really understand how to make this work. And I think we know the answer. The answer is that actually, you know, like community engagement. So for instance, I think, so SONJO is, for example, is the right kind of program to really promote the right messages and so on. At the end, also about understanding the disease etiology, or, you know, the way that it spreads. So, for example, I think, you know, there is very little understanding of, I mean, even till today, I mean, the science has moved on, but I think there is lack of understanding of long COVID. I think Michael sort of really referred to that in his presentation. I think, and also you may, you know, you did highlight the issue of long COVID. Long COVID implication is something that it is just the tip of iceberg. So we don't know. The science hasn't really gone up to that level of understanding the implications of long COVID, because, you know, well, just like any other coronavirus, like this virus really affects the respiratory system, pulmonary systems, and so on. And this is going to really create lots of challenges. There are some cohort studies from the US and a few other places, including China, which clearly demonstrates that, well, people have, you know, people have continued to experience certain, comorbidity along with, you know, those people there are different groups you can actually consider. These people with some underlying health conditions and people with no conditions, but who have been exposed to COVID before. And probably there is another group, which is a latent group, which is the reinfection rates, or the groups that have been exposed before and have also had further exposure. That is actually also a critical group. But the question is that, well, by the time we come to a greater understanding or better understanding of the challenge, it's going to be probably too late, right? So I think my only kind of reflection on this would be it is better to be safe than to be sorry. So to have that responsibility imparted in minds is actually the need of the hour. Because there is a lot of speculations around vaccination. So in fact, first dose of once you have a first dose, then you are really, your body is shielding the other side effects. If you have a second dose, then you're fine. I mean, that we don't know yet. I mean, that's still a gray area in science that we need further research and exploration. And that's where I think programs like SONJO could really provide a very meaningful kind of understanding of different community behaviors. So I'll repeat myself that repeat again that everything is down to community, and that's the only way for solution. And that also includes knowledge promotion, public knowledge promotion, coordination of activities like what we've seen. I think and also the kind of preparation. The ICU preparedness, for instance, in case of tackling emergency. All these will have to be really managed consistently and with greater coordination.
I would like to invite other speakers as well to add on this. Maybe Pak Rimawan or maybe Mas Gumilang probably have a experience on how to educate the community and how to use this community-based movement to minimize the negative effect of, like, let's say COVID hesitancy or vaccine hesitancy or a COVID denial. I know there's something probably that we have talked a lot, but in terms of community movement, what has been done, Pak Rimawan?
Yes, thank you. So one of the thing that we do a lot in SONJO is discussing among members, basically, and many members may just inform us the difficulty is dealing with the people. But then also we have another problem is actually somewhat is some politician the way they give the statement is somehow contradict to the reality, and that is even challenging actually. And using organization like SONJO like this, and then we can try to persuade them, and then we can talk to other ministers, for instance. And I said, please, minister, please tell your colleague not to say that, because it's hurting people. It's just like and saying that at the moment when the COVID is surge, and then all of a sudden one of the ministers said that, okay, we have to mobilize, we have to open tourism, or we need to open a school, for instance. Then in that circumstances, then we can do some kind of we can try to discuss with them. And the same thing occur for the people. And when we share our experience. And then one of the example is actually Bu Ani did this, and it's very, very interesting. What Bu Ani did is that prior to the Lebaran, the Eid festival, apparently the message, if the message has been given by the officer, they don't believe it. Okay, and because they said, okay, don't go back home because this is something like a Christmas. Eid is like Christmas. Everybody coming home, and the government trying to deter people to coming home. And how to do that? And the most effective way is what experienced by the Bu Ani is that Bu Ani tell to the family in her neighborhood, and then to tell the relatives not to go home. So if the message is come from the relatives, their own relatives, they're more they can accept it more rather than if the Bu Ani herself tell to them, don't go home, for instance. So this kind of some sort of like behavioral approach that we can use, and it's very interesting when we have a group like Sonjo, because everybody can share, and then we can have all of a sudden we can have, okay, now that is good, that is a good practice, and then we try to do it, and then if it is successful, that will be they can be spread out through several villages. Okay. Thank you.
Thank you, Pak Rimawan. So I
also
think
just to quickly add, because Pak Rimawan also made a very important point regarding Ibu Ani talking to family. I think that's also an important aspect, because at the end of the day, it's also the household behaviors. Like a child or a son or a daughter is looking to their father or their uncles or their brothers or sisters. So therefore, it is very, very important that when you have communication channels in place through WhatsApp and so on, it is paramount that messaging has to be put in the right format, and for which I think we definitely need expertise in digital marketing or or communication, different kinds of communication tools. And there are HIV is one example. For the last 3 decades, I think we have been really struggling with this with that epidemic. I mean, it was not a pandemic, but although it had the potential to become a pandemic, but so the investment, if you look at the investment, the level of investment, we were all initially focused on knowledge promotion, the right messaging. Well, for instance, there were concerns that touching would contract HIV. But so these were really myths. So where do you really draw the line? I think that becomes very, very important. And sometimes the commercials, like commercial products, they do excellent marketing. I mean, I think so if McDonald's can attract young people to their products, why can't we really think of in a public health community? Why can't we think of the right messages and to inform and empower people with information? So information empowerment is critical in the whole kind of framework.
Yeah, so that's the intersection between the movement and something more academic in terms of trying to understand the behavior of people, because when you have contradictory messages from the government, from the politician, from people who are supposed to believe it, right? And that's tend to be counterproductive in the COVID alleviation, COVID mitigation, and things like that. So yeah, thank you so much, Pak Rimawan and Pak Sabu. I started to call you Pak Sabu, and this is not really good.
No problem.
No problem. I'm getting too anyways.
I'm local.
I also want to extend, because if we don't have other question, I want to extend the question to Michael. Actually, what did you find in Ghana in terms of people having mixed message from the government, mixed message from their leader, and how community actually help with spreading the right sort of or news or yeah. Is it family based? Is it in Indonesia, or is it different kind of communications? Or
so we think, obviously I'm on the outside looking in, so I'm learning a lot from my Ghanaian colleagues and friends and partners there. But I think they are getting a lot of their information partly through friends and family, often via WhatsApp or Facebook maybe, but also through local leaders. So that might include church groups, so the local sort of pastor or church leader. It will include, as we discussed briefly, the local healthcare worker. It might be a village elder or tribal chief or other equivalent individual who has a high status. And often what these people say is what the community then goes and does and believes. And there definitely are some For example, some church groups are actively spreading misinformation around the vaccines. We know that. So what I think one good approach would be to educate and work with those leaders, that small group of individuals who might represent a few different aspects of the community, with, for example, what are the conspiracy theories around vaccination and how can you best counter them? Often the conspiracy theories do spread around the globe quite easily. So there is one, for example, that the COVID-19 vaccines affect fertility of women, and they don't. We know that. But there are also the scares around blood clots, which is a real but rare adverse event from the AstraZeneca vaccine. So there needs to be good communication around risk around the use of vaccines. So, and it needs to be proactive. Certainly the world, and also here in the UK, has been reactive with its public health decision making. It's why here in the UK we have a measurable fraction of our population who are dead of COVID-19, because we are reactive with things like interventions like lockdowns and so on. So if we can be proactive around the pandemic response more generally, but including dissemination of good, positive information. I think it was Professor Sabu who said we must promote positive messages as much as we can. And I think that's right. But positive and accurate messaging can help to quell hesitancy and therefore increase the uptake as and when the vaccine is then available in an often hard to reach area. So in Indonesia, you have what, 17,000 islands or so, and you have to get healthcare to each of those islands. It's a huge task. And I've no idea how you manage it normally, let alone during a pandemic. And certainly once you get the healthcare there, once you get the vaccine across to that island and into the community, what you don't want is the community to then say, we don't want this. Because then all of that hard work, getting the vaccine from the manufacturing site in India or the Netherlands or wherever it is, around the world, across boats and aeroplanes, into that rural community for them to be wasted. So proactive approaches to information before the vaccine gets there is vital, and targeting a few well-placed individuals who are influential, I think, is key for everyone here in the UK, but also in Indonesia, in Ghana, and elsewhere around the world as well.
All right, another question for you, Michael, like a really quick one. For Sonjo's approach to work in Ghana or in the UK, what would need to be changed or tweaked? This is from Natalia Sabaggio. Thank
you very much for the question, Natalia. I think local context is what would be tweaked and changed. You might have a framework. So what you've done with the SONJO initiative, with the WhatsApp groups, the big network of groups, I think is extraordinary. And that could be taken out of Indonesia and put in Ghana. But you would need some kind of local context, local Ghanaian knowledge to make sure that it just is tweaked and it works okay. So one project I didn't mention that I'm on the periphery of, but is happening in Nkwanta, is they are using WhatsApp groups to pass on messages around emergency admissions. So if a local healthcare centre has just received a pregnant lady who is bleeding heavily, and they need to send that pregnant lady to the nearest hospital, which might be, of course, quite a long way away or quite a long time to get there, it would be helpful when that pregnant lady arrives that she gets the right attention as soon as she arrives. So therefore, the WhatsApp groups are being used to disseminate referrals, basically, from healthcare centre A to hospital B, so that the obstetrician is available when the pregnant lady arrives, so that they have some blood out of the freezer if they need it, things like that. And that has been piloted and has proven, I think, quite successful. It's quite kind of basic, but it works in that setting. So I think taking knowledge like that in Ghana, taking the SONJO initiative in Indonesia, they meet in the middle quite well, and they'll just be kind of local adaptations in each setting to make it work better in each setting. But again, there can be that exchange of knowledge. Knowledge translation is huge in this. We all have limited resources, so we need to use what resources we have better. So I think bringing lessons learned across countries, across continents, is something that could be quite exciting about this initiative right here.
All right, thank you. Thank you so much, Michael. I think I would like to extend the questions as well about the information about the danger of COVID to Bu Ani. Ibu, apakah masih bergabung dengan kami? Ibu Ani? Jadi tadi ada pertanyaan mengenai penyebaran informasi mengenai bahaya COVID gitu nggih, Bu Ani. Jadi terutama kalau di desa, kemudian juga mengenai vaksin, kan mungkin permasalahan seperti yang di Ghana tadi juga di Indonesia mungkin ada orang-orang itu ragu gitu untuk divaksin. Nah ini di daerah kemudian di desa. Bagaimana ya Bu, cara kemudian kita itu mengajak masyarakat supaya hesitansinya, tingkat keraguan-raguannya itu rendah, begitu. Ibu masih di mute, kami tidak bisa mendengar suaranya. Ya, nggih, sampun Ibu.
Intinya bukan sosialisasi ya, bahwa kami pemerintah desa dengan relawan-relawan desa lawan COVID-nya tak henti-hentinya turun ke masyarakat memberikan sosialisasi melalui relawan desa lawan COVID baik tingkat RT maupun tingkat padukuhan, karena kita punya relawan yang berjenjang dari tingkat basis yaitu tingkat RT, kemudian tingkat padukuhan, tingkat desa, dan naik sampai tingkat kabupaten. Sehingga kolaborasi kami biaya Mas itu biaya untuk penanganan COVID saja kita tanggung bersama-sama. Tadi kita sebutkan, belum kita sebutkan ya tadi, 55% itu yang menanggung adalah pemerintah desa. Kemudian 24% itu yang memberikan bantuan adalah pihak ketiga. Kemudian 21% ini adalah masyarakat. Ini salah satu wujud bagaimana kolaborasi sinergitas antara pemerintah, masyarakat, dan relawan. Sehingga dalam menangani program vaksinasi pun kami juga dengan kolaborasi tiga segitiga atau tiga elemen tersebut. Termasuk juga dalam rangka menyampaikan problem-problem ataupun berita-berita yang untuk penanganan COVID, kami juga bersama-sama antara relawan, masyarakat, dan pemerintah desa. Sehingga ada tiga pilar, termasuk juga kami senantiasa memanfaatkan tokoh-tokoh masyarakat, ketua RT, kemudian tokoh agama, kemudian juga pemuda, tokoh perempuan, itu semua kita libatkan jadi satu dalam rangka penanganan COVID-19 agar kami cepat memutus mata rantai COVID-19. Intinya adalah kolaborasi, sinergitas antara beberapa elemen, terutama antara pemerintah, masyarakat, dan pihak ketiga bersama-sama memutus mata rantai penyebaran COVID. Dan tentunya berita-berita bohong, berita-berita yang tidak benar yang mengatakan bahwa COVID itu tidak ada, insya Allah di tempat kami itu tidak terjadi. Karena dekatnya antara pemerintah dengan masyarakat dan lembaga, sehingga kami bisa mengantisipasi problem-problem permasalahan yang akan menyebabkan COVID ini sulit ditanggulangi. Ini yang kami lakukan, kolaborasi dan
Baik Ibu, tadi ada relawan berjenjang itu yang sepertinya kemudian lebih dekat ke masyarakat gitu ya untuk menyebarkan berita yang memang benar dan positif, Ngaten. Ya ini luar biasa sekali effort dari Ibu dan teman-teman. Baik, matur nuwun sangat Ibu untuk jawabannya. Ini enlighten. Semoga bisa direplikasi di desa-desa lain ya Bu ya, karena ini kalau saya cuma mendengar berita-berita yang saya nggak tahu apakah itu benar atau tidak, tapi sepertinya banyak masyarakat di desa itu yang sangat nggak mau vaksin tuh ragu-ragu, bahkan yang sepuh-sepuh juga ragu-ragu gitu kan, padahal mereka yang kemungkinan terpapar dan menjadi parah. Baik, matur nuwun Ibu untuk jawabannya. Alright, we're running out of time. We're actually 5 minutes past the scheduled time. I think this is, really, when you're having fun, time flies, no doubt. I would like to thank everyone, Pak Rimawan, for the, oh my God, I'm just lost for words. The effort that you have done with Sonjo, with everyone, the volunteers, everyone involved. Bu Ani, Mas Gumilang, thank you so much. Also, our guests from University of Southampton, Pak Sabu, Pak Michael, and Pak Paurav. So I'm calling you Pak, right? it's Indonesian way to be more kind of like friendly. But yeah, I do hope that you all enjoyed the webinar today. I hope that we learned a lot. I know that I learned a lot. Hopefully, you guys did learn a lot as well. I thank you so much for coming to this webinar. Thank you for tuning in. It's more than 2 hours, but thank you all for the speaker who comes today to share the knowledge, to share information, everything. I hope that we all stay safe and stay healthy. And thank you, everyone. Again, good evening, good morning if you're in the other part of the world. Good afternoon. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh.